All right, so just a few of the basic taping supplies that you'll come across in the treatment room. So first thing that is typically applied is tough skin, so an adhesive spray. Heel and lace pads to prevent friction on the anterior and posterior aspect of the ankle when taping ankles. Pro wrap or pre-wrap, just for hairy legs and hairy arms and patient comfort. And as well as your basic athletic tape. We use Johnson & Johnson tape primarily, which is of pretty high quality. And then there's also a conform tape, Light Plast Pro this is called, which is very flexible and moldable and is great for applying pads and other wraps. And then this tape, this is a heavier brown tape, tough to tear, very durable. Elastoplast, this is, Elastoplast this is called. So you'd use that for some heavier tape jobs or heavier duty tape jobs to reinforce things. And then from here we're going to flow into basically sort of your standard tape job for a lateral ankle sprain. So we're looking to prevent plantar flexion and inversion with this tape job. So the first thing we'll do, and of course Nick is not allergic to any adhesives or sprays, so we're clear there, and we'll give him pretty good coverage with this. And we have to give this a minute or two to dry and become tacky, otherwise it's just going to be really wet and slick. And all I'm going to use for this tape job are heel and lace pads, pro wrap, and regular athletic tape. And I'll always ask Nick, like I mentioned, I'll take one quick step back. We're looking to prevent plantar flexion and inversion, which is, your primary mechanism of a lateral ankle sprain. So I'm going to ask Nick to hold his foot opposite of that. So basically hold it in his stance, keeping his toes pulled up towards him. One heel and lace pad on each side. There's a little bit of Vaseline or lubricant jelly on each side of that to help it stick. And then we'll start with our pro wrap. Trying to keep it smooth, and you can see I don't unroll the roll of pro wrap too much. I basically just roll it onto him. Now you'll see some people who do tape onto the skin, some people who will, some who won't. Typically I'll apply enough tough skin spray where the pro wrap and the tape will adhere to, so I don't necessarily need to go onto his skin due to that. And I'll start with anchor strips. I'll start from the top down. And depending on the person's leg length, I'll use anywhere from 3 to 5 anchor strips at the top. And I'll also, keep your toes up, I'll also apply 1 or 2 around his foot. Always use a little bit of caution coming around the foot, not to pull too tight, because that foot has to be able to naturally splay and spread itself out. If the tape is too tight around his forefoot, then he's going to get some foot cramping and some discomfort with that. So for a lateral ankle sprain, I'm going to start with stirrups after my anchors and pulling everything to his lateral side. So again, reminding him to keep his foot or his toes pulled towards him and pulling that tape up onto the lateral side. Secure that with a horizontal strip, and then I'll add another stirrup, again pulling up to the lateral side. Followed by one more horizontal strip, and then a third stirrup. And if you're able to see, I'm staggering my stirrups so that they're not one over top of the other, but they overlap by about half a tape width. So keep your foot in that position. So from here, now I've got my 3 stirrups and my 3 horizontal strips. From here I'm going to flow into a figure 8, and then I'm going to go into a heel lock. And I typically do these continuous, but it's totally acceptable to split these. So here comes my figure 8. I start on the top of his foot. I flow partially across the base of his 5th metatarsal and up around his ankle and back to the front of the foot. And there's my figure 8. That's done. Now I could tear that there and then restart with a heel lock. I typically flow from here and go right into my heel lock. So I continue on, keep them in that dorsiflex position, pulling behind the ankle, really cinching up around the malleolus, so I'm pretty firm around the front. And now I'm coming around the back side of his heel on his medial side, and then up to the front. And I can tear that pretty much anywhere along there. Okay, so after the figure 8s and heel locks, and the one thing to watch for is little windows. I have a very small window right on this side, and I have a little one on the other side as well. And you just want to make sure those windows are well covered before you close, so that skin doesn't have a chance to bulge through that window, and then you'll get a little bit of a, almost sort of a blood blister, or a little bit of bruising there sometimes, or just some discomfort, or maybe even a tape cut from that as well. So always close up your windows if you have any windows after you're done. And then I'm going to go back and I'm going to close the whole thing over, which is very similar to how I started. I'm going to start at the top and work my way down. A couple small things of note as you work through this process. You know, if they have significant discomfort on that lateral side of the ankle, you may need to use a bit of caution as to how and where you tear the tape so that you're not pressing on those painful areas. I typically overlap the tape by about half the width of the tape. And continue on closing all the way down. And finish off with that same strip around the foot to close it all together. And then of course you want to check for distal pulse and make sure they get good capillary refill. Easiest way to do that after a tape job is to squeeze their nail bed. Watch that it blanches once you squeeze it, but then refills with blood after the fact. So it goes from white and back to red. And if it stays white, then he's not getting appropriate capillary refill, and that tape may be too tight. And then of course patient comfort and how it feels both in sitting and then once he's standing, and making sure it's functional as well. One of the taping supplies I didn't mention earlier was the tape shark. This is for tape removal. There's one very sharp edge in there, and it actually does look a little bit like a shark, but I'll let Nick cut this tape off for himself because I have no idea if I'm cutting into him or if he's not comfortable with how that's gliding. So he's typically going to come down, he's going to go behind his medial malleolus, and then he's going to flow to the front part of his foot. He may get stuck along the way, and done. And then it peels right off in one giant piece. And that's it. So the next tape job that we're going to perform is for a plantar fasciitis, which is basically a strain of the connective tissue along the broad band across the bottom of the foot and pain through the arch of the foot. So I'll start that with an anchor around his foot as well. I typically don't use pro wrap on this tape job. So one anchor around the forefoot, and the other anchor flows from one side of the foot to the other, And that's it for anchors, and I'll close that in very similar fashion with a little bit of a twist. And then to support the arch itself, I'm going to apply some teardrops, both from the medial side, flowing around his heel. And I like to do mine going back to my starting point in a teardrop fashion. Some people will, and I'll do it this time, some people will figure eight it around the heel and then continue back to the opposite side. But like I mentioned, I prefer to keep it one side at a time. I guess on that note as well, it's worth noting that there's many right ways to perform similar tape jobs. So the ways that I'm doing them now are comfortable to me and what I'm used to, but there are other correct ways to do that. I split the roll and use about half the tape width while I'm doing this. And typically we'll put 2 or 3 from each direction onto the foot. And then to close it, I'm going to put full strips from one side of the anchor to the other, closing all of that over and making sure you don't have any windows there as well. And then I'll put another horizontal strip around to close. And then one more full strip around his forefoot again. Again, giving him a little bit of space to splay that foot so it's not too tight around that forefoot. And that's known as a low dye tape job for plantar fasciitis. Okay, so the next tape job that we'll perform is for an Achilles tendon strain. And for obvious reasons, there's lots of precautions around this in regards to returning to play. So I'll perform this as though it's an Achilles tendon strain, but just note, if this was maybe more of a calf strain or even a soleus strain, I would probably anchor this higher up at the origin of their calf or just below their knee. But we'll do this as though it's an Achilles strain. So basically I'll put one anchor, I'll use Light Blast Pro for my anchors on this, and I'll do it just near the bottom of her calf belly. And then one anchor around her foot as well. And for this tape job, I'm going to keep her in plantar flexion while I perform this tape job. And then we'll use the elastoplast, which has quite a bit of stretch to it, but you want to take a lot of that stretch out of it. So I'm going to attach that to the anchor at the top. And I'm going to cover that up right away to hold that in place. If I had somebody with me, I'd probably get them to hold on to that a little bit while I take some of the tension out of this tape. As I pull it down a little bit, then I'm going to fold this over. 1, to give the tape a little more strength, and 2, to keep it from adhering to the back of her leg. The other thing you can do with that as well is slide 1 or 2 heel and lace pads in there for them to make sure that's not irritating at all. And 2 things you can do. You can fix that directly to the bottom of the foot, or you can split that tape and wrap it around the foot which is what I'll do for this tape job. So I'll split it almost to the bottom of her heel and then just wrap it around and fix it to the top of her foot on each side. She's done a good job to stay in plantar flexion. Close around her foot with the elastoplast, and then I'll close the rest of the tape job as well. So, and the idea behind that is that we're keeping her out of extreme dorsiflexion. That tape's going to give a little bit, so she'll still be able to move once she bears weight and puts her feet on the floor. But it's meant to take her out of that extreme dorsiflexion position and actually assists her in getting back to plantar flexion. So the next tape job, I'll show two variations of this one, is just for a patella tendonitis. So it's typically that anterior knee pain just below their kneecap, between their kneecap and the tibial tubercle. So patella tendon will often, you'll notice it in volleyball players, basketball players. So fairly common but nagging and irritating for the athlete. So one thing people will use is just pro wrap. And just step that foot back a little bit. Good, thanks. Just a little bit of knee bend there, not much. So a lot of athletes will be comfortable just with the pro wrap, so I'll probably wrap around 4 to 6 times and then just have that pro wrap roll to create a little more tension. Like I said, in that area that's just, sorry if I just pinched you, that area just below the tip of her kneecap and her tibial tubercle, right there. And some athletes are suffice with that and feel better with that. So that's one version, and then another one, I'm gonna switch legs, is with a small foam pad to put pressure on that patella tendon. I would start that with some pro wrap just to hold that in place. And then I would apply, I'd use some Light Plast Pro. Ideally, I'd probably use a 2-inch roll of that as opposed to this 3-inch roll, but I would just fold this to create a little more pressure on top of that pad. Just want to make sure you don't pull that too tight behind their knee where it's pretty easy to cut off some circulation. So you just lay it across the back of their knee. But then I would pull it a bit more firmly and a bit tighter across the front part of their knee. And then just lay it across the back. And finish with that. Okay, so another common injury that you may come across is a hip flexor strain. So a strain of the anterior thigh muscles as it crosses the hip. So first thing I'll do is get her to heel wedge. I'll put just a half roll of tape or an old roll of tape under there. I'll get her to come into some knee flexion, and I'm going to ask her to turn her toes out a little bit for me. So a little bit of external rotation at the hip. And then with a 6-inch, so one of the double length 6-inch tensor wraps. And I'll start, just have to use a bit of caution not to be too tight around the thigh. You need to be firm with your wrap, but not to cut off any circulation. So I'll typically go once or twice around the thigh. And then I'm gonna flow around her waist. The other thing you can do as well with this is have her bend forward at the waist a little bit. Perfect, right there. Which is gonna make it a little easier for her to pull into hip flexion. And then I'll just keep that continuous around her waist and around her thigh, and just figure eighting that position. I'd finish that off right there, and then I would, can you put a hand on there for me? Thanks. And this is another good wrap to use the Light Plast tape with. as it's very versatile, and cinch that up. And then again, just making sure that that's not too tight or cutting circulation off to her leg, and making sure that's comfortable for her as well. This wrap's going to look very similar to a hip flexor wrap, but this is more for a growing strain or a strain to the adductor complex. So I'm going to get Paige to put her heel on that again, bring that knee into a bit of flexion, and then I'm going to get her to bring her toes, turn her toes inward. So to put her hip into a little bit of internal rotation. And I'm going to pull that wrap, whereas I pulled the wrap for the hip flexor towards the outside. Now I'm going to pull that wrap towards the midline. So same, I'll get once or twice around her thigh. And I'm not sure if you can see from where the camera is right now, but her legs are fairly close together right now, which is good, because we want to prevent some abduction at the hip. So a couple times around the thigh, then again around the waist. She doesn't have to lean forward this time. And then I'll just keep that continuous. So biggest difference being toes into internal, or hip into internal rotation, toes inward, wrap being pulled towards the inside, and then legs just a little bit closer together while you're setting this up. And then again, I'll get you to hold that for a moment. Thank you. And light Plast Pro to help close that off as well. And again, making sure that's not too tight around the thigh where she's having circulation cut off to her leg at all. The next tape job we'll do is for an elbow hyperextension. So just trying to prevent that extreme end of elbow extension. So, and Paige has very good elbow extension. Unfortunately, she's not painful in that position right now, but that's what we're trying to prevent right there. So I'm going to get her to hold her arm into some flexion. And I'm going to use Light Plast Pro for an anchor around her bicep. Flex a little bit for me against my hand. Again. So one anchor there, and then one just below the musculature of her forearm. And then I'll use the elastoplast tape basically to create a bit of a bridge between those two anchors. So I may have to trim this a little bit once I take the tension out of this tape. So I'll secure that lower portion. Take a lot of the tension out of that tape. I'll fold it over much like I did on that Achilles tape job earlier. So in a way, it's almost as though you're replicating the bicep tendon, your distal bicep tendon on this. That's probably going to be a little too tight. So let that slack off a little bit. Keep your arm right there. And then I'm going to secure that top anchor. And then just have her ease back. And the idea, like I said, you can see that tape may pull away a little bit, so we may have to reinforce those anchors a little bit. But the idea is that she won't be able to get into elbow hyperextension with that. So the next tape job we're looking at is to prevent wrist hyperextension. So I'll put a little bit of spray. Turn over, please. Oh, I didn't need to spray your fingers, but I did. And then let's keep your hand right there. Spread your fingers out a little bit. Great. And often when I'm pro wrapping a wrist or a thumb, I'll try to just poke it through the thumb and just start it from there. It's not a necessity, but it does make, if you can get it to happen, it does make it a little smoother. So our anchors this time, just above the wrist. Hold your arm pretty firm. It's an easy tape job to cut circulation off to people's fingers and hands, so you have to check that again, as always. So there's my anchor strips, and then I'm going to apply one through the hand as well. So I'll start that tape right there. I'll usually pinch the tape a little bit as I come around the thumb so as not to dig in to the crease of the thumb too much. And figure eight that around the hand. So that started here, came under, around the thumb, and through the hand, and then finished back onto itself. Okay, so I'm going to keep her in a little bit of wrist flexion. We're trying to prevent wrist hyperextension. So I'll put her in a little bit of flexion, and I'm going to put 2 added support strips in an effort to keep her into a bit of flexion. If it was somebody with huge hands or bigger forearm, I'd probably use 3. 2 will suffice for that. And then I'm basically going to close everything over the same way I started. So hold that arm and that hand pretty firm. This is where I'll probably apply a couple of extra strips around the crease of her wrist, just to reinforce that a little bit more. And then I'm going to close the same way I applied that anchor. And that's almost done, and like I said, I'll add one more through the crease of her wrist as well, just to give that a little bit more support. And that's it. Okay, so the next tape job we'll do is to prevent thumb hyperextension. Typically would be for an ulnar collateral ligament sprain. So I'll get her to keep her thumb into a little bit of flexion. And I'll pro wrap this fairly similar to how I started the pro wrap for the wrist. I'm going to run an anchor strip, just one anchor strip that'll be continuous. So it'll look fairly similar to what I did with the wrist. Keep your hand pretty firm, please. Pull that over the base of the thumb. And so there's my anchor strip. And there's a number, like most tape jobs, there's a number of different ways to do this. Next I'll put on what we call hoods. And I'll usually put 3 of those on, staggered at different starting points. Just to cup around the thumb. Try to immobilize it slightly with that, and thank you. Again, I'm going to split this tape roughly in half, and I'm going to put some teardrop strips, really focusing on that particular joint of the thumb. Bring that in a little bit. Good. And I'll usually put 3 of those on. And then from there, I'm going to start to do some figure 8s around that joint, and also through her hand as well. So it's basically a continuous figure 8, or a thumb spica. Spread your fingers out a bit. Good. And I'll tear that off at the back of the hand. You can see that window right there, so I'm going to cinch that up. And I'm going to close that the exact same way I started it. And there is the thumb tape job.